Dr. Engelken is a professor at Iowa State University's College of Veterinary Medicine. He's been involved he was raised in Kansas. He was been involved in veterinary practice. He taught at Mississippi State, and then we were fortunate enough to get Terry at Iowa State, where he works in the clinical sciences, and he has done some research that's been funded by the Beef Checkoff, and he's going to go through that and lead us into the discussion. So welcome, Terry.
I'm going to kind of walk through a background on the disease. Again, like Dan referred to, it makes you want to pull your hair out. And it's a disease that's been around a while. And certainly I can remember back when I was at Mississippi State in the early 90s, it was pretty much a dairy disease at that point. And it was new enough in beef cattle that we had a bull come in that had it, and everybody literally dropped what they were doing and ran to the clinic to see this lesion. And now we're to the point where, God, I'm sick of looking at hairy heel warts. So anyway, we'll kind of walk through kind of a background on it, and then highlight a study that was funded by the checkoff dollars through the Iowa Beef Industry Council, and hopefully leave some time for discussion afterwards, and we'll roll from there. So from a historical perspective, this disease was first described in the 70s in Italy, and you'll hear the term a lot, spirochete-like, and basically that's the family or the genus of the bacteria that was originally blamed for this disease was Treponema, and you'll still hear that a lot. But over the years, there's been attempts to reproduce this lesion using Treponema organisms by itself, and they failed. And so has been a hard one to reproduce. And we'll talk a little bit about that until Paul Plummer came along, who's one of my colleagues at the vet school, along with his grad student, Adam Kroll, and figured out how to do that. So we're a little better at being able to reproduce the disease in calves so that we can study it a little bit better. We will see antibodies, so there is a systemic effect of the immune system, even though those lesions are at the, down on the foot. But the exact etiology remains pretty elusive because in the early lesions, and we'll show you this, but in the early lesions, we don't see much in the way of. And in the later lesions, it's the most prominent organism there. So we're missing, a few steps. We're missing what is that initial thing that really kicks this disease off? And so we'll kind of walk through this basic project as we go through here. So as you're well aware, these lesions occur on the back side of the foot. They start out with circular or oval, have very clean edges early in the disease. And then in the late or chronic ones, that's where that term hairy wart or hairy heel wart came from, because you have these projections that look like hair. They're actually more protein or papillae, but that's where the lesion gets its name from, is those lesions that look like hairy, that you see every day in your feed yard. On histopath, when we look at them with the diagnostic lab or the microscope, we see ulcers where the skin has been eroded. And then we see this proliferation, again, toward the more chronic lesions. And the interesting thing is that about 80 to 90% of these lesions occur on the back feet. And I don't know why that is. And I've talked to a lot of smart people about this, and I'm not sure why that occurs in that regard. I was at a conference recently where the Canadians were looking at risk factors associated with hairy heel wart development. And one of their risk factors that they said is that it occurred more commonly in heifers. And they didn't have a good explanation as to why that occurred. So there's still, we're not going to get all the answers today because there's still a lot we're trying to understand about this. Pain response does tend to show up as we get more advanced lesions. The early lesions aren't that painful, but again, you've seen these cattle that shift the weight to the front of the toe to keep the lesion off the floor because it's off the fat, because it's on the back. And, they cock that foot forward and, at least a lot of our clients, they'll kind of use that when they start to see those, okay, it's time to run them through the foot bath again. Anytime cattle are less active, they don't walk as much, their feed intake drops, and then we see decreased feeding performance. And part of the study that we did as part of this, that was funded by IBIC, we saw about, at the low end, about a 0.12 decrease in average daily gain, all the way up to about a 0.2 decrease in average daily gain when you compared cattle that had lesions versus those that did not at the time of closeout. So there certainly is a performance difference. Our risk factors, not really well understood. Is there immunosuppression going on? These organisms typically don't do a very good job, or at least certainly in the case of treponema, they do not penetrate intact skin. So there has to be some sort of, whether it's, wet environment and we see compromise, too much mud, too much manure, we get softening of that area in the back, and then allows those organisms to start to penetrate. Mixing cattle from different sources, again, does that contribute to immunosuppression? Is it, again, spreading like any other disease when they're susceptible? We blamed Holsteins a lot, but in the survey work that we've done, guards that have problems with hairy heel wart typically haven't fed Holsteins, or if they have, they've quit feeding them and haven't fed them for a long time. So I'm not sure we can blame this thing on the Holsteins anymore. But as we see this, lesions go from early to late or acute to chronic, we see the bacterial population change, and we'll take a look at that. And that was one of the questions we had with this story, or with this project, was I was hearing from veterinarians that they felt like hairy heel warts in their dairies acted differently than it did in their feedlots. So that's part of what we wanted to look at this, and we'll get into that. But it looks like when we're looking for either a viral cause or a fungal cause, fungus, didn't really find it in these lesions. So it doesn't appear that there's any viral or fungi involved. This population of bacteria changes as we go from each of these lesion scores. And one of the things for sure, and I'll show you this in a little bit, but as these lesions get more chronic or get older, we see the treponema organisms increase dramatically. And it appears to take about 90 to 100 days for these lesions to start to get bad enough to where we see some lamenesses. And I know at least it's very commonly in our clients to where we start to see these lesions about the time we re-implant. And then they really get bad about the last, 60 days on feed. Can be worse than that, but we're hitting the foot baths pretty hard at that point. So as we look at these lesions, we use a 1 to 4 scale that was, again, pretty much developed by Paul Plummer and his colleagues there at the vet school. And so this would be a lesion number 1. So we've got just a slight, we got some hair loss, a little bit of fibrosis. We don't have any ulceration yet. Cattle are not lame at this point. And again, just for orientation, here's the back of the hoof, coronary band, interdigital cleft, and here's our dew claws up there. And so again, we have this little bit of just a little bit of an early start to the lesion. Over here, again, this one's a little different, but again, kind of running on down here a little bit farther, a little bit of hair loss, just getting started. Our lesion number 2, or grade 2 lesion, again, just starting to get a little blood, where we've got ulceration, we've got the outer layers of the skin being taken off or dissolved, and just a little bit of blood. Not really any fibrosis yet, and typically the cattle aren't necessarily that lame at this point either. Lesion number 3, again, we're starting to see more of ulceration, and loss of integrity. So these lesions are getting deeper, still a very nice, well-defined edge to the lesion. But again, this is when we start seeing lameness, when we get into the late 2s and into the 3s on these. And then here's another one that would probably be a little more advanced, but still a 3, where we, again, a little deeper, ulceration, missing more tissue, the skin is gone, and now we're into the deeper tissues, and certainly these cattle are going to be lame at this point. And then here's where the disease gets its name. Here's our number 4, or chronic lesions. Again, we've got a very widespread lesion here. We've got these fronds coming off, or these hairs coming off, and again, the cattle, this big clump of tissue here is kind of a combination of fibrin or fibrosis and granulation tissue or proud flesh. Again, that calf is just trying to fill that lesion in, and they're very, very lame at this point. And so then this is where if you look at some of the other studies, we see the biggest decrease in feeding performance in cattle that have this type of lesion. Okay, so that's our scoring system. 1 is mild, 4 is very more of the chronic. So this was some work done by Paul Plummer and his group in dairy cattle. And basically what they did is they took biopsies of these lesions and ran through and to see what bacteria is there. And so we have 0, we have normal skin, early lesion, number 2, number 3, here's our chronic lesion, number 4. And this was a set of, you can kind of ignore number 5. That was a set of cattle that they had treated with a tetracycline rat, and they just wanted to see what they were looking at. So what we're interested in is 1 through 4. And these are the various families of bacteria that are involved at these various lesions. Here's our spirochetes or treponema here, this big blue area. So you see, as these lesions become chronic in these dairy cows, we have these just explosion of, as we go from 1 to this explosion of treponemas. And basically that's really where the disease really was first looked at, and that's why there were vaccines designed against treponema. But because you have all these every one of these different colors is a different family of bacteria. So this isn't just one bacteria involved with this. It's not like, wow, we got an IBR outbreak or we got a BVD outbreak, let's make a vaccine and it'll work. It's not going to work with this if we ever get down the road to with a vaccine, is we're going to have to figure out, number 1, what do we need to have in the vaccine? And number 2, even if we include treponemas, the treponemas that we find in lesion number 1 are different than what we find in lesion number 4, or these chronic lesions. So not only do we have a change in the bacterial population, we have a change in species as we go across here to make these more chronic. So, but again, you can see as we get our treponema increase, we see it pushing out these other types of bacteria. And so we have a very different profile early than we do late. The other thing that happens that, again, what Plummer's group came up with is that there's some of these lesions that would progress from 1 to 2, and then they'd stop, and they would revert back and heal. So there's some type of trigger that we don't know what it is that occurs somewhere in here that allows these lesions to go ahead and progress to a painful into the 3 and into the 4. So yeah, I'm probably going to tell you a lot more about what we don't know about this disease today than what we do know, unfortunately. So again, this is kind of the bacterial profiling that we're using to try to understand, what's going on there. Treatment-wise, injectable antibiotics have not really been that useful. And in fact, that's one of our rule outs when I talk with veterinarians or producers over the phone. When they're talking about lame cattle, they think it's foot rot, but it's not responding to antibiotic. Typically, when they start looking, that's when we find hairy heel warts. routine foot baths are really our primary, as many of you are using, at receiving, reimplant. There's folks that are using 3 consecutive days of foot baths at arrival on a routine basis, every 30 days, every 3 weeks. I think we see these big differences in how people or different operations handle this is due to the fact that we're not really happy with anything that we're being able to use or being forced to use. I am talking with a company about an injectable product now. It'll be interesting to see how that shakes out. But again, at least for now, we're talking primarily copper sulfate or formaldehyde. Individual treatments, can be sprayed with a backpack sprayer with tetracycline or formaldehyde, or bandaging. I think Dan hit it. Bandaging gets old really quick, and we may try that on a few, but most of the time we're headed back to foot baths, and that's really about what winds up being our unfortunately our best treatment option at this point. But again, injectable products have not worked well for us, have seen very little efficacy that oral antibiotics, whether it's CTC or Thailand. We really, if you look across the board in studies that have been done, it's hard to show a real advantage to those. So as I kick off this dermatitis project that was funded by Iowa Beef Center, or excuse me, the Iowa Beef Industry Council, I need to give a shout out to 3 individuals. One here, Paul Plummer. Paul is one of those really big brain guys who just a smart dude and very practical in his approach. Has a long history of working with DD, has been just a super helpful to me. Amanda Kruder here, who was one of his previous grad students, again, who has helped a lot along the way. And then Andrew Severin over on campus with the Genome Informatics Facility. Andrew is a number cruncher. He wouldn't know what a hairy heel wart looked like, but in order to do these bacterial profiles, huge issue with computer space and computer work. And an example that some of the files that on our biopsies took about 45 minutes to download onto my computer. And so he's a big data guy that has really been super helpful on this. So again, I'm giving the presentation today, but we've got a group there at the vet school that's really interested in hairy heel warts. So here's a project that was funded by Chekhov. And basically we wanted to profile biopsies on hairy heel warts to compare it to what was done in the dairy industry. Do the lesions behave differently? Would it have an impact on management strategies? Could this be the first step toward vaccine development? And so we collected samples from 9 different feed yards and 1 packer. And basically we get one to look under the microscope and for special staining. And the other biopsy went to over on campus to the genomics facility to, again, do that bacterial profiling that I showed you previously. And so here's where our cooperators, and just a huge shout out to these folks. They let us come in, steal one of their employees for about half a day while we collected these. Cows or cattle, Joe Kilberg over there in Eastern Iowa, Greiman Brothers, Jim and Julie Christensen up with Royal Beef, Van Borst, Greg Pudens, Up Churches over there, one of our clients that we're feeding for Barkay, Green Feeders, H&S Farms. And then at the end of the day, I had to go up because those very early lesions or score number 1 are hard to come by in the feed yard because they're not lame. So basically, talk to Darren Cook and Travis and Ed Greiman up there at Iowa Beef, and they are Upper Iowa Beef, and they basically allowed us to come in there and collect feed and get the samples that we needed. So again, a big shout out and a big thank you to these folks who really made this thing possible. So basically what we did was we find a calf here that had a lesion. We blocked it with lidocaine, gave them a local, pulled up the, used a 4 millimeter biopsy punch, and that's the size of the biopsy that we got. And then put one of it for our metagenomics or our bacterial profiling, drop that in a liquid nitrogen until we get it back to the lab. And the other one that we took went into formalin for histopath so that we could, before we ran the metagenomics on it, we was indeed a hairy heel wart lesion. So this is this was up to the packing plant. But again, here's one of our early lesions. And that gives you kind of an idea as to what size the biopsies were. And then once we got our biopsy taken on the live calves, we'd wrap the feed and with a tetracycline wrap. This is what happens when the calf kicks the biopsy tool and you biopsy yourself. Rumor has it, I said some bad words that particular day, but actually that's a pretty clean biopsy right there. I mean, it's got the skin like I needed and left the underlying tissue intact. So thought about submitting that to the lab, but some of our pathologists don't have much in the way of a sense of humor. So this is what the lesions look like under the microscope. So basically, what you're seeing as that ulcer on the outside of the calf, when you're looking at them grossly in the pen, this is what this is. This is all just really a little bit of fibrin, but mostly blood. There, and you can follow along here where my pointer, hopefully. And that's where the lesion is just gone. The skin's gone. Okay, and so with the animal's just trying to fill this in with fibrin and blood, and there's infection going on, and there's little purple things or white cells. So the calf is trying to deal with it. Then we used a special stain as well that would, for the spirochetes or the treponemas. And you can see in this particular issue, these long little chains, fronds of bacteria, all of these are spirochetes, just long chains of spirochetes. And so we had to have a lesion that looked like hairy heel wart. Oops, my bad. And then on histopath, we had to have a lesion. And then to ensure that it was a hairy heel wart, we had to find evidence of the treponema organisms in here. And then these down here with the purple, those are just a lot of bacteria along the way. And again, if you think back to the picture that I showed you with the profiles, shouldn't surprise you that we see a lot of bacteria. But this is what the organism looks like, or the lesion looks like underneath the microscope. The other thing we did is we had lesions that looked like this, that we sampled because they were just, looked to us like just classical hairy heel warts. And but histopath, they weren't, and they didn't have any of those spirochetes in them or treponema organisms in them. So we took a subset of those and ran them through the metagenomics or the DNA facility to see what was going on with them. But according to what we found in the first phase, even though they sure looked like hairy heel warts, they didn't act like it when we got them back to the lab. Okay, so here's what we found. And so here's our normal tissue, 0. Early lesions go across here, number 4. Here's our chronic lesion with the hairy protrusions. And here's number 5 is those lesions that didn't, that sure looked like hairy heel wart, but didn't work out that way in the lab. And so again, what we're seeing here is really kind of the same distribution, different colors, as what we saw in the dairy cattle. So in our early lesions, we have a few spirochetes. Again, this other bacteria here, this other is bacteria that made up less than 5% of the population. So we just lumped all them together and call it other. But each one of these different colors is a different family of bacteria. And so you look over and this orange, burnt orange kind of thing, that's our spirochete or treponema. So then as we go from 1 to a 2 to a 3 and a 4, we see again this big explosion of our treponemes, just like we saw on the dairy cat. And then we see as these expand, we see a decrease in the other populations like you'd expect. They're just crunched down. And so then we get over here and look at our fives. It would appear that our fives are really kind of may have been healing lesions. They've been past the chronic stage. And you start comparing, and they kind of look like they're between maybe a 2 and a 3. So it looks like these fives were, for whatever reason, were on their way to healing up a little bit. So anyway, that's very similar to what we saw in terms of these distribution and change in bacterial families or bacterial types as we move from an early lesion to a late lesion, like we saw in the dairy cow. Same thing, just another way of looking at it. Again, here's our normal skin. A lot more diversity in the bacterial families on the normal skin than what there was in these late lesions. But again, here's our big orange, a little bit of orange for our spirochetes or treponema in our early lesion, but just a continued explosion into our chronic lesions on 3 and 4 when they become painful. And then as you look at our fives here, again, the ones that we really didn't know what, they look like they're probably healing so they're kind of looks like somewhere kind of between a 2 and a 3 when you look at their distributions, the blue and the red and the brown here, very similar along this way. So I guess the short answer to this is that these lesions the proportions are a little bit different. But if you look at the bacterial families that are there, these lesions are just almost dead spot on as to what they found on the dairy cattle when Dr. Plummer and Dr. Kroll did their work in that regard. So let me see where are we at here time-wise. Okay. Yeah, because I wanted to leave a little time for discussion. But again, when you look at these bacterial profiles, they show a great similarity in feedlot versus dairy lesions. So I think we've answered that question. I think differences in how these lesions behave are really associated more with how we handle feedlot cattle versus dairy cattle. I mean, we're looking at those dairy cattle feet. The workers are down in the pit twice a day. They're easy to foot bath versus so they get ahead of those lesions. Versus in the feedlot where we tend to be a little more reactive, trying not to get the cattle out of the pen unless we absolutely have to. So when we look at, there's a classic kind of a 3-legged stool when we talk about any kind of disease. There's host factors, there's management factors, and there's pathogen factors that all go together. And I think what we need to continue to do is a better understanding of how does this organism survive in the environment. We see it in hoop buildings, we see it in monoslopes, we see it in slatted floors, we see it in outdoor cattle. All that kind of gets into it. And so what's going on there? We've got I've had an opportunity, and I think we are potentially looking at this. The poultry industry has a lot of technology that they utilize in poultry litter or their bedding packs. And I was talking with some of our poultry veterinarians and looking at some things like sodium bisulfate or aluminum sulfate, ferric sulfate. They've got some poultry litter additives where they have tied sulfuric acid to a clay carrier. And basically what they're trying to do is that reduces ammonia production. It keeps the pack drier. And it changes the pH to inhibit the growth of bacteria. And that might be something that could be useful in looking at some of our bedded pack buildings. It's interesting, there is a product out there called Stalisan F that I know of a producer who used it in his confined cow-calf operation or in his building and really felt that did a great job of reducing ammonia and keeping the pack drier. And one of the things he noticed is that the pack isn't as hard to remove when it comes time to clean it out as it was before he started using the product. And so there might be the potential for something that we can use to treat the pack with on a routine basis that would be cost competitive with foot baths if we saw. I think that's an area that we're going to pursue. What are the animal factors, again, that affect lesion development, prior to arrival, after arrival? One of the things we struggle with is what is that initial insult to the skin that allows some of these, for example, these organisms to penetrate. And certainly the treponema that we've talked about repeatedly does not impact or does not penetrate normal skin. It looks like on the Holstein side of the equation, they're looking at susceptibilities from a genetic standpoint to hairy heel warts. And again, that's kind of in its infancy. So not a lot to report there, but they're certainly looking at that. This organism, Dichelobacter nodosus, what role does it play? That causes foot rot in sheep. We do find that in these lesions. It is one organism that will can penetrate healthy skin and works very nicely with Fusobacterium, which again is what we normally associate with foot rot. So, what is that a key player? Is that the potential that could be used when we look at perhaps vaccine development? And then what is the real efficacy of mats in our confinement barns? Though you would think that those feet tend to stay pretty dry in these as long as we, as long as they're pushing the manure through into the pit. Does that contribute the way cattle stand up on mass? Does that contribute to these lesions occurring primarily in the back feet? I think that's something that, should probably be looked at, because it's obviously frustrating in the slatted buildings with those floors when we see these lesions. Are there better options for treatment besides the foot baths? Cost compares, obviously we've got to be able to cost compare it. What's the cost of the vaccine versus number of doses? Again, we're really in our infancy looking at that. What bacteria should we select, or what combination of bacteria? Again, looking at these profiles that we've seen with these lesions. Is there an immunostimulant, or what other methods do we have to improve foot health? We are starting to see, unfortunately, some bacterial resistance in hairy heel warts. And again, that shouldn't surprise you. As when we treat cattle for respiratory disease, that doesn't just affect the lung in terms of the development of resistance, but all the bacteria in the body of the animal. So we are starting to see some tetracycline resistance that's been reported in the literature. But to the end of the day, it really gets down to, it's all fun and games if it doesn't pencil out. So some of these changes that in terms of we might, whether again be different foot bath or foot bath combinations, looking for natural immunity or resistance in the cattle, the cost of a potential vaccine and the number of doses, all that's got to be compared with, and to our current situations with foot baths where copper sulfate, it's in our hands runs about $89 for a 50-pound bag, or those 275-gallon totes around $1,450, that, and the labor again associated with cattle putting them through the foot bath. So I think this was a good start to understanding where we're at, and again we're going to pull our team together and see where we want to go next with this. So with that, I'd be happy to take any questions or anything. I don't see anything in the chat right now. Okay.
Terry, question came in, and it's a compound question. Would it be helpful to biopsy some normal asymptomatic calves from these pens to look at the bacterial profile? And the second part of the question is, are the bacteria found all truly associated with the biopsy of the lesion, or are we picking up some bacterial just from the environment?
Great question, and the answer to both of those is yes. We have done. If you look at those slides that I gave you, or that I showed, over on the left-hand side of those, the 0 lesion was normal skin, and so that's what we compared the 1, 2, 3, and 4 lesion 2, they are definitely different. And there is actually, if you look at, there's another, I didn't include it in the profile, but there's another test that we did that shows that there's actually more bacteria, a more diverse set of bacteria, if you will, in the normal lesions than what there is in the 3s and the 4s. Again, as those treponemas replicate and push everything out. So yeah, the answer to that is we have looked at those, and those profiles are different. The second thing was, the second question was, we did as best we could, on the dairy biopsies, they have advantage of, they bring the cow in, they tip her over, they can clean up the lesion nicely. You don't want to be too aggressive when you clean it up, because then you're scraping bacteria off the skin. But we basically, when we were cleaning the cattle up, the only thing we used on them was distilled water, because again, disinfectants would change the bacterial population. I would suspect that, and that was one of our fears, so that's why this is a good question. That was one of our fears, that we would see a lot more fecal contamination, just because, we're in the back of the squeeze chute with a foot pulled up in the air. I had a Jake, which was Jake Green, who was a vet student who worked for me, who was a big husky retired Marine, and he could move a foot like nobody's business. And so thank God for Jake. But we cleaned him up as best we could. But I was surprised at how well these matched the dairy. So this is a long and windy answer to say, I suspect we had more manure contamination than they had on the dairy side, but I don't think it was a big factor in terms of the results that we got. So anyway, great question.
Dr. Engelken, question about the progression of the disease. So you mentioned 100 days for the lesions to develop, but we know they can progress much quicker than that. So, go between stages, the duration can be, I don't know what it is, but it seems to be variable or depending on other, just how fast it may go from an M1 to an M2 and so on. And then with that, when is the foot bath intervention most effective?
Okay. If you look at from when I say 0 to, or about 100 days, that's from normal skin to probably a 2. To go from a 2 to a 3, your observation is correct, but to go from a 1 to a 2 is quicker than that. To go from a 2 to a 3 is quicker than that. And in dairy cattle, it's maybe a little bit longer. The earlier you can get them in the foot bath, the better the response. But keep in mind, the foot baths do not cure the lesions. Okay. We basically, with that formaldehyde or that copper sulfate, burns the lesion back, but we never, ever, ever get back to normal skin during the feeding period. And so what you're seeing is what a lot of people will think is that, okay, I foot bathed them today, I've got to do it again in 30 days. Typically, those aren't new cases. They can be, certainly, but a pretty good percentage of those are just going to be reoccurrence of previous lesions. So the earlier, if you're seeing lame cattle, with that classic kind of foot cocked forward where they got the weight on the toe and they're trying to keep the weight off the heel. If you're seeing some of those, you're probably already behind. So those cattle need to go through the foot bath. And I think even it may be, if you've got a history, the first time you see them with the lamenesses in a pen, you run that pen through the foot bath. I would almost be willing to bet the best thing to do would be to put them on just a scheduled 3 to 4 week rotation, whether you're seeing a lot of lame cattle in the pen or not, because they're, you're, again, keep in mind, they really don't get painful until lesion 3. Well, you've got 1s and 2s coming behind that. And so the earlier you can get into the lesion, the better off the foot bath, or the more effective the foot bath would be.
You've been kind of talking around this question, Terry, but can a foot bath be preventative?
Yeah. And we have, I've had reports, and that's a frustrating thing for the producers and veterinarians and nutritionists or anybody that's involved with this, is that I have had people say that if you, on the day the cattle arrive, for the first 3 days they're there, put them through the foot bath. And in many cases, that will hold them all the way through the feeding period. Now, pen conditions are going to play a huge role on that. If we have wet, sloppy pens, where I mean, if you're in the swimming pool too long, your skin prunes. You know, there's a term called slurry heel in cattle that came over from our friends across the pond. That basically, when cattle stand in that soupy, wet manure, you look at between the dew claw and the coronary band, you know, that skin starts to pickle. And when that happens, it's compromised and it's wide open to these hairy heel wart organisms. So I think the best thing we can do is be very aggressive with pen maintenance, whether it's indoor or outdoor. And I don't have any answer for you on slatted floors, because those pens aren't wet. They're not standing in manure. We sure see a lot of them, hairy heel outbreaks in those buildings. But no comparisons that I've seen, but I have heard producers that are using a 3-day, once a day through the foot bath, the first 3 days after arrival. And they feel like in a lot of cases that will hold them all the way through the period, or all the way through the feeding period. But they've also got to be doing really well on pen maintenance for that to happen.
We got one more question.
My question was, you said that 5% was your target for the formalin percentage. How many head can you run through before you need to either clean it out or put more water and re-up your formalin?
Right. Kind of the classic, and I don't know, honestly, first off, I don't know without testing it how we know that. I'll just be blunt and honest about that. The number that I see reported constantly is 250 head. And I don't know where that number comes from. I don't know. I think the key is when they're going through the foot bath, we got to have a big enough foot bath that each hoof gets 2 dunks, and we've got to have it dew claw deep, so that, you know, we don't see these lesions above the dew claw. And I think that is a better indicator of you know, when we need to recharge the foot bath than number of head. Now, obviously, if we get a lot of manure in there, you know, the copper sulfate probably is more affected by manure and organic matter than what formaldehyde is. You know, there's been reports of temperature issues. If we get, you know, below 35 degrees, formalin isn't quite as effective. You know, we need to keep an eye on that. But I think as what we tell our clients is, I'm more concerned about depth, maintaining the proper depth in the foot bath, than you know, X number of head that we're going to run through. You know, there's some commercial products out there that rely on a color change, and that aren't formalin and aren't copper sulfate. They're different compounds, and they'll tell you when it goes from a deep blue to a pale blue, it's time to recharge. But I think, to me, the critical factor is our foot bath long enough that we get 2 dunks per hoof? Is it deep enough to we're up to the dew claws? And then once those cattle go through, do they stand on dry ground, or something dry for about 30 minutes to let the foot bath take effect? So the stock answer is 250 head. I don't know where that came from. But I think use your judgment on how contaminated it is and how deep how deep it is.
Let's give Terry a round of applause. We won't ask what's in that red Solo cup. We're glad you have pants on. And for your answer on us, we just draw straws and someone has to run through the foot bath barefoot. And if it still burns, it's still good to go.
There you go.
But anyway, thank you very much, Terry.
All right.
Appreciate all you do.
All right. Take care.